Have you ever walked out of a doctor's appointment feeling more confused or discouraged than when you walked in? You're not alone. We are diving into 5 things your doctor should never say to you about pelvic pain. Actually, it's 6 because I couldn't leave the last one out. It's just that bad. Now, these are real things said to real people, many of them my patients. And if you've ever been on the receiving end of something like this, I want you to know we believe you. It wasn't your fault. It wasn't helpful. And we can do better. Physicians and other healthcare providers, this is also a gentle reminder our words matter. Choose them with care. Let's jump in. Thing number 1, have a glass of wine. Yes, I was actually told this myself years ago for my pelvic pain. And believe it or not, many women are still being told this today. Just relax, unwind. You're too stressed. Have a glass of wine. Let me ask you this. Do we treat back pain or shoulder pain with a prescription for Merlot or Malbec or Riesling? No. Then why are we still suggesting alcohol as a treatment for pelvic pain? Spoiler alert, it doesn't help. And it sends a message that the pain is imaginary or that you're just being dramatic. You're not. You're in pain. You deserve real care, not a wine list. Thing number 2, just do Kegels. Oh, this one. Just do Kegels is not a one-size-fits-all solution, especially for pelvic pain. In fact, for most people, especially those with tight or overactive pelvic floor muscles, Kegels can make things worse. Now, pelvic pain often comes from muscles that are too tense, and doing more squeezing just piles on more tension. Instead of defaulting to just Kegels, we need to ask, what's really going on? Are these muscles too tight, too weak, or not coordinated properly? You see, pelvic floor therapy looks at the whole person, the whole picture, not just one generic exercise. And please, please, please consider that if you get pitched the Emsala Kegel chair or any Kegels done for you device, okay? Thing number 3, well, I don't see anything wrong with you. Oof, this one stings. Now, if you've ever heard that, you know how invalidating that feels. Just because a provider cannot see something on a scan or an exam doesn't mean nothing is wrong. Pain is real. And just because it doesn't show up on an MRI or a scan or a test doesn't mean it's invisible. Pelvic pain is complex, and it often needs a team approach. And pelvic floor therapists, we are trained to assess things that don't show up on your standard imaging. We see you, we believe you, and we are here to help. Thing number 4, it's all in your head. Now, maybe they didn't say that directly, but you know that's what they meant. Now, listen, pain is never just in your head. Yes, the brain is part of the pain experience. Emotions, stress, past trauma, they all play a role, but that doesn't mean the pain isn't real. It just means that there's more parts to this puzzle, and we can treat it if we stop dismissing it and just start listening. So no, you're not imagining it. You're not making it up. You're not crazy. And you don't have to be stuck in shame or silence about it. Thing number 5, well, you'll just have to live with it. No, absolutely not. Now, you might have been told this when other treatments didn't work. But if no one's mentioned pelvic floor physical therapy yet, let me introduce myself. I'm Laura McKeag. I'm a licensed physical therapist and a pelvic floor specialist. One reason I chose this specialty about 10 years ago is seeing how it changed people's lives and how people got so much better. Pelvic floor therapy is often overlooked in the treatment of pain for both men and women, but it can really help. So if someone told you to just live with it, I'm here to tell you something different. You don't have to. There is help and there is hope. Ready for number 6? You're the worst case I've ever seen. Can you believe someone actually says this to a patient? Now, this one wins the award for the worst thing patients have ever heard from a healthcare provider or their doctor. Now, listen, how is that helpful at all? Think about it if you're a healthcare provider. When patients hear this, they often feel defeated, like there's no point in trying any further, like they're broken beyond repair. That's not helpful at all. But here's a different perspective. If you've been told this, maybe the advice you got was the worst, not your case. If you've heard something like this, please get a second opinion or a third. You deserve better. So, what wild, unhelpful, or downright harmful things have you been told about your pelvic pain? Drop them in the comments, not to vent, though you totally can, but to help us change the narrative, to help others know they're not alone, to spread some truth, and to share some hope. If you're looking for trustworthy information and down-to-earth guidance for pelvic pain, hit subscribing or grab one of our free guides below. Because your pain is real and there is a way forward. Remember, you don't have to just live with it.